We have in the last 2 weeks, actually on January the 30th, the FDA approved the first new non-opioid pain medication in the last 30 years. And this is a new class of drug, a new mechanism we've not had before, and it does not affect the brain, so it's not an opioid. It does not appear to have side effects like significant euphoria or the effects we see in the brain or abuse potential based on mainly short-term studies. It's only approved right now for acute pain up to 14 days. And it works by blocking the pain signal at the source of the pain, so the pain signal doesn't get to the spinal cord and doesn't get to the brain. So it blocks it from getting to the central nervous system, and we've never had a drug to do that before. So it's a new class, and basically this new chemical class fits that mark. And it's only based on a couple of studies where it's been compared to placebo and it's been compared to hydrocodone plus acetaminophen, like Vicodin. And what we've seen is it appears to be similar in one of the studies, which is mainly abdominal tummy tucks, and the other one is bunionectomies, and will appear to be a little bit slower onset than the opioid, but in both studies it's superior to placebo, about the same as the opioid, and does not appear to have the abuse potential. The problem with it is that there's no long-term data yet for chronic pain. There's one study that did look at it in a small number of patients for neuropathic pain. It looks like it might be effective there. There's a little bit of data outside of the 2 post-op studies that we've looked at, but not enough information yet. So it's acute pain for 14 days. You take a 50 milligram dose, 2 for the first day, and then 1 50 milligram dose twice a day thereafter. So at this point in time, it looks like that we're going to see more use of the drugs, because you're going to replace NSAIDs, non-steroidals like Advil or ibuprofen plus Tylenol combinations, which is where many of us have gone and get great efficacy, including in post-traumatic, fractures and sprains and ER data. That 2-drug combo appears to be magic and probably as good, if not better, than the opioids. This one hasn't been studied against that, but some of the comparative data suggest maybe not quite as effective, but the pain scores are in the right direction. So stay tuned. It's the first one we've had in 30 years, and it looks like it might be helpful, but it's $800 for a month's supply. If you got the number of doses you need, be $800.